Hello guys and welcome back. This is the second video about echocardiographic modalities and I'm going to talk about the Doppler imaging. Don't forget to like this video and subscribe to my channel. So let's start. Doppler echocardiography is a method by which one is able to identify the direction and velocity of blood flow. Doppler can be used for various purposes in echocardiography and it should be an integral part of every examination. To correctly interpret Doppler information, you must understand how the technique works and its limitations. The principles of Doppler as we use it in echocardiography were discovered by Christian Doppler. Christian Doppler was able to show that the observed frequency of a wave depends on the relative speed of the source and the observer. The principles of Doppler have many uses in daily life. Just think of the sound of an ambulance or a motorcycle as it speeds towards you and then away from you. You will notice that the sound of the vehicle has a higher frequency as it comes towards you and a lower frequency as it moves away. This principle can be applied to ultrasound waves to determine the velocity and direction of moving blood. We can determine the velocity of blood cells by measuring the magnitude of the frequency shift between the send and the receive signal. Also, we can determine whether the blood is flowing towards the transducer or away from it, depending on whether the phase shift is positive or negative. We can also apply the Doppler principle to tissue, such as the myocardium. A Doppler examination is a valuable adjunct to a complete echocardiographic examination because it's capable of measuring normal and abnormal velocities of blood flow non-invasively. For the first time, this procedure allows non-invasive quantification of stenotic gradients, intracardiac pressures, and blood flow, as well as semi-quantitative assessment of regurgitant lesions and assessment of diastolic function. With this procedure, the operator must progress through a learning curve in order to gain a complete understanding of the examination techniques, the limitations of the instruments, and the Doppler physics principles before applications can be made to clinical practice. The Doppler examination is best used as an adjunct to a complete two-dimensional echocardiographic examination. In this setting, a complete Doppler examination of all cardiac valves and chambers is ideal. As is true for any new technique, a learning curve exists. At least 6 months of dedicated training in a busy echo lab may be necessary to gain a full appreciation of the utility and limitations of this technique, and also to develop special skills for examination. The examination can be time-consuming, and a complete Doppler examination may consume as much time as a complete two-dimensional echocardiographic examination. When a Doppler examination is being performed, the following important concepts should be remembered. First, the Doppler audio signal may provide the best guidance for obtaining an optimal examination. Second, the Doppler signal is optimal when the ultrasound beam is almost parallel to the blood flow. When 2D echocardiographic guidance is being used for the Doppler examination, the two-dimensional image will allow approximate placement of the sample volume. The first systematic study of blood flow through cardiac valves by transcutaneous Doppler examination was conducted in 1973. They evaluated the Doppler-derived flow in various valvular lesions and reported excellent comparison with findings on intracardiac phonocardiography. They used an intracardiac Doppler probe to determine the velocity patterns of blood flow through normal valves and found that the patterns obtained from intracardiac recordings were similar to the transcutaneous Doppler patterns. By using this information, investigators have established that both pulse wave and continuous wave Doppler techniques are accurate for detecting areas of abnormal turbulence and assessing the presence of valvular stenosis or regurgitation. With the Doppler formula, we can calculate velocities based on the Doppler shift between the sent and received signal. The measured velocity greatly depends on the angle between blood flow and the ultrasound beam, so always try to be as parallel as possible. General and clinical applications. The clinical uses of Doppler echocardiography in the evaluation of cardiac conditions in adult patients involve five major categories. First, valvular stenosis. An increase in forward velocity through a stenotic valve can be detected by Doppler echocardiography. The peak gradient across the stenotic valve can be obtained from the magnitude of this increased velocity. And thanks to this, the severity of the stenosis can be assessed more precisely. Second, valvular regurgitation. The presence of valvular regurgitation is detected as retrograde flow across a valve. Although absolute quantification of the degree of valvular regurgitation is not yet feasible, a mapping of the extent of regurgitation flow into the receiving cardiac chamber allows semi-quantitative assessment of severity. Third, blood flow. Measurement of blood flow velocity as well as the area through which blood flows allows an estimate of volumetric blood flow. This estimate can be applied clinically as a non-invasive method of determining cardiac output. Fourth, intracardiac pressures. In the presence of valvular regurgitation or intracardiac shunts, the peak velocity of abnormal blood flow is proportional to the difference in pressure between the two cardiac chambers. And fifth, intracardiac shunts. The presence of an intracardiac shunt will result in abnormal velocities and patterns of blood flow at the site of the shunt. Doppler echocardiography has been of great value in detecting intracardiac shunts in patients with congenital heart disease, and studies are being done on the quantification of shunts. The concept of Doppler imaging is familiar to all those who have heard a police siren. As the police siren travels towards you, the frequency of the wave appears to be higher. As the police siren travels away, the pitch appears to be lower. Estimates of blood flow velocity can be made by comparing the frequency change between the transmitted and reflected sound waves. In cardiac ultrasound, Doppler is used in three ways. First, continuous wave Doppler. Second, pulsed wave Doppler. And third, color flow Doppler. Continuous wave Doppler. A continuous wave Doppler transducer has two crystals, one that continuously emits an ultrasound signal and a second that continuously receives the reflected signal. Consequently, an instantaneous Doppler shift frequency between the emitted wave and the reflected wave can be measured, and the maximal frequency shift that can be determined is very high. Within the clinical range, no aliasing occurs, and velocities in excess of 7 meters per second can be measured. Unlike the pulse wave mode, in which a precise volume is sampled, the continuous wave mode will receive a wide spectrum of frequencies from blood motion by the entire beam. Two types of continuous wave transducers are available. The first one is a small transducer without imaging capabilities, also called the blind probe, and the second one is a duplex transducer with capabilities for both two-dimensional and Doppler echocardiography. The smaller non-imaging transducer has been most valuable for assessing valvular lesions. Because of its small size, this transducer can be placed into multiple ultrasonic windows, a technique that often cannot be used with a standard larger imaging transducer. The optimal signal is one with the highest velocity and the cleanest spectral envelope. The transducer used for continuous wave Doppler uses two piezoelectric crystals. One continuously emits ultrasound and the other one continuously receives the signal. Because it sends and receives waves continuously, the continuous wave Doppler cannot sample backscattered waves at any specific point along its pathway. Rather, the returning ultrasound waves represent all ultrasound frequencies reflected by moving bodies in the path of the continuous Doppler beam. The major advantage of this Doppler modality is that very high velocities can be accurately measured because sampling is continuous. The major disadvantage is that it cannot sample a specific point along its pathway. Continuous wave Doppler is sensitive, but because it measures velocity along the entire length of the ultrasound beam and not at a specific depth, it doesn't localize velocity measurements of blood flow. It is used to estimate the severity of valve stenosis or regurgitation by assessing the shape or density of the output. Pulse wave Doppler. Pulse wave Doppler was developed because of the need to make localized velocity measurements of turbulent flow. Pulse wave velocity measures the blood flow velocity within a small area at a specific place. It is used to assess ventricular inflow patterns, intracardiac shunts, and to make precise measurements of blood flow. Pulse wave Doppler imaging allows sampling from a specific intracardiac depth. A pulse of ultrasound is transmitted, and after a specific time interval, the transducer briefly samples the backscattered signals. This transmit, wait, receive cycle is repeated at an interval termed the pulse repetition frequency. Because the wait time is determined by the depth of interest, the pulse repetition frequency is depth dependent. That means the pulse repetition frequency is high for a nearby point of interest and low for a distant one. The ability of pulse wave Doppler to sample from a specific point is hampered by a phenomenon called signal aliasing. For accurate determination of wavelength, a waveform must be sampled at least twice in each cycle. In pulse wave Doppler, signal aliasing results in a waveform that may appear to be moving in the opposite direction of its actual direction. The Nyquist limit is the maximum frequency shift detectable by pulse wave Doppler. Because a wave needs to be sampled at least twice for accurate determination of its wavelength, the Nyquist limit is 1/2 of the pulse repetition frequency. If the velocity of interest exceeds the Nyquist limit by a small degree, signal aliasing is seen. If the velocity is much higher than the Nyquist limit, the wave wraps around the whole spectral display, making very difficult to determine the original direction. When talking about pulse wave Doppler, it's very important to remember two things. First, the pulse repetition frequency limit within which aliasing occurs is known as the aliasing or the Nyquist limit. And second, aliasing occurs when the velocity is more than 1/2 of the pulse repetition frequency. Pulse repetition frequency is an important aspect. To a certain degree, the pulse repetition frequency can be increased to permit higher velocities to be displayed. However, the maximal pulse repetition frequency depends on imaging depth. Aliasing will occur when the velocity exceeds the Nyquist limit. The Nyquist limit is equal to 1/2 of the pulse repetition frequency. Use the baseline shift to stretch the Nyquist limit. In summary, the advantage of pulse wave Doppler is that it is site-specific. Its disadvantage is that higher velocities cannot be measured. Aliasing phenomena. Aliasing is best explained by the analogy of a clock. Let us assume that you are observing a clock at 15-minute intervals. Obviously, you will note that the hands move in clockwise direction. However, if you were to use a longer observation interval of 40 minutes, you will gain the impression that the hands move in counterclockwise direction. This is exactly what happens with pulse wave Doppler when the velocity is too high. The interval of the ultrasound pulses is the time interval between your observations of the clock. When the pulse repetition interval is too long relative to the velocity of blood flow, it will not be possible to determine the direction of blood flow. Color flow Doppler. The advent of color Doppler was a breakthrough in medical ultrasound. With this technique, it became possible to directly observe blood flow within the heart. Such visualization is achieved by color encoding Doppler information and displaying the colors as an overlay on the 2D image of the heart. The colors represent the speed and direction of blood flow within a certain area of the image. By definition, flow towards the transducer is shown in red, while flow away from the transducer is shown in blue. Different shades of red and blue are used to display velocity. Lighter shades of color are assigned to higher velocities. The exact manner in which velocities are displayed is defined by the so-called color map. Ultrasound scanners are usually provided with several maps from which the investigator might choose. Some maps encode turbulent flow in yellow or green. Turbulent flow is present when there are large variations in flow velocity within the sample region. The information is consistently updated from frame to frame, providing a clear view of how blood flows. The main advantage of color Doppler is the fact that one can view blood flow simultaneously in many regions of the heart. However, in contrast to pulse wave Doppler and continuous wave Doppler, the color Doppler only permits semi-quantitative assessment of blood flow velocities. So, the color flow Doppler uses measurements of the velocity and direction of blood flow to superimpose a color pattern onto a section of a 2D image. Traditionally, flow towards the transducer is red, flow away from the transducer is blue, and higher velocities are shown in lighter shades. To aid observation of turbulent flow, there is a threshold velocity, above which the color changes. This leads to a mosaic pattern at the site of turbulent flow and enables sensitive screening for regurgitant flow. Color flow Doppler imaging is based on the principles of pulse Doppler echocardiography. However, rather than evaluating one sample volume depth along a single beam, it evaluates multiple sample volumes along multiple sampling lines. Because Doppler color flow imaging is a pulse Doppler modality, aliasing occurs, and velocity above the Nyquist limit will show a bright yellow-white with color reversal. Color flow Doppler is optimized to accurately demonstrate blood flow within a region of interest. As the predominant function of color flow Doppler is the assessment of valvular regurgitation, the Nyquist limit should initially be set to between 50 and 60 centimeters per second. Doing this standardizes the color flow Doppler appearances across all echocardiograms and avoids the inappropriate appearance of low velocity blood flow or turbulent blood flow. However, adjustment of the Nyquist limit is recommended when assessing PISA, PFO, or ASDs. As with the standard 2D gain, color flow Doppler gain should be optimized with each patient. Now let's talk about appropriate spectral tracings. Several factors must be considered if one wishes to obtain good spectral tracings. The quality of the Doppler signal is greatly dependent on the quality of the 2D image. Always optimize the 2D image before you use Doppler. Use color Doppler to guide the positioning of your sample volume and Doppler line. This will help you to observe the location of the flow as well as the direction of the jet. To obtain better results, always align the Doppler wave parallel to flow. As on the 2D image, artifacts are encountered with the Doppler technique as well. To avoid such artifacts, you might need to reposition your Doppler sample volume or use a different 2D reference image. Use the focus when performing continuous wave Doppler. Baseline shift and sweep speed should be adjusted accordingly. All machines are equipped with a baseline filter which can be used to disregard low velocity signals and artifacts. In this image, I'm showing you how I use the reject and compress buttons to improve the quality of the pulse wave Doppler signal. By using this tool, you can see how the image on the right appears to be more clean, sharper, and without noise. Here I'm showing you how I use these two features, the scale and the horizontal sweep, to optimize the pulse wave Doppler signal. You can use this tool to increase or reduce the size of the signal. The baseline is also a very important feature to optimize the tracings. You can move the baseline up and down to be able to appreciate better the spectral Doppler. As you can see in the first picture, the blood flow was going towards the transducer, and I had to put the baseline lower to be able to measure it properly and to appreciate the whole extent of the tracing. You can find these optimization tools on every echo machine. These features are made to optimize continuous wave Doppler signals, pulse wave Doppler signals, and color flow Doppler signals. Thank you for watching. I hope you can find all this information very useful. This was a highly requested video and was a pleasure for me to do it for you guys. So don't forget to subscribe and see you on another video. Bye!